Hello, welcome to the program. I'm Stan Grant. We're coming to you from Sydney tonight on what's been, yes, another dark day in this pandemic. 5 deaths in New South Wales and Victoria now in its 6th lockdown. Our questions tonight come from all over Australia and the world, and so does our panel. Joining us, CEO of the Property Industry Foundation, Kate Mills. Former New Zealand Prime Minister Helen, who led the independent investigation into the global pandemic response. The New York Times Australian Bureau Chief, Damien. In Washington, high-profile epidemiologist Feigl-Ding and vaccine specialist from the University of Sydney, Julie Leask. And from Jakarta, Chief Editor of the Indonesian TV network Rajawali Televisi, Yulia, Supadmo.
Hi, my name is Sophie. I'm an Australian currently living in London with my 10-week-old baby and husband. I have a question for Q&A tonight. I would like to know what Australia's long-term plan is, given that there aren't enough vaccines to go around, and it's unlikely that the uptake will be strong enough to meet that 80% rollout. When will national and state borders reopen? When can Australians return home? What's the long-term plan? Can Australians still call Australia home?
Julie Leask, what a day to ask that question. Victoria going back into lockdown, as we mentioned, New South Wales seeing the numbers continue to creep up. That question about when do we get to the end of this, when do the borders open, seems a long way away, doesn't it?
It does right now. It feels like fairly dark times with Delta around and having such a struggle to control it here in New South Wales and outbreaks elsewhere. I think fortunately last week we had some targets released by the Prime Minister from that modelling from the Doherty and colleagues, which suggested that around 80% they were going to allow people into the country if they were vaccinated from overseas. So I think it's nice to have that goal to work towards, but I appreciate that that could take some time. And in the meantime, there are families who are separated in this way and people who can't get home. And it's just one of those very, very difficult things about this pandemic.
Kate Mills, even at 80%, and just going to that Doherty Institute findings there, their own research, we're still going to have potentially thousands of cases, and they're warning that in the worst case scenario, you could have over 1,000 deaths a year as well. Are we ready yet to have that conversation, even at 80% of what life might look like?
I think it's going to take quite a long time for Australia to get to that conversation, and that's because of the very specific strategy that we have taken, us in New Zealand, which is about having 0 deaths. Versus when you compare it to other countries and most of the world where they've I hate to say it, they've got used to those numbers, if you like. So if you look at what's happening in the UK at the moment, and I note that Sophie was wearing no mask and out and about on what looked like the South Bank in London, where because people have got used to those horrific numbers of 50,000, when they come down to 25, 26,000, people start to feel more comfortable. I think for us, it's obviously going to have to go the other way. And it's interesting to see when in New South Wales where you've got 200 a day at the moment, and people do start to get accustomed to that number. They start to go, I'm expecting the number to be around 200. So for us, we're going to have to travel in the other direction. In the end, and we're going to be talking about this a lot, I think this is, we talk about this being a race. This is a race where we only win when everybody gets to the finish line. Like if the UK is sick, we're at risk. So we've all got to kind of arrive there at different times. The real question is going to be when we get there and you look back, do you think you took the right route? And at the end of the day, I think Australia's taken, a route that only it could take because of what happened right at the beginning when we closed borders quickly, which is going to give us a very different result, which is going to be fewer deaths.
Can I bring you in here, Helen, and just get your assessment of looking at what's happening in Australia, looking at New Zealand as well, and you've had similar issues there around vaccination, you've had issues around lockdown, we've had a travel bubble with Australia, which is then, we've hit pause on as well. But how do you see Australia right now and where it is positioned?
Well, Australia's approach has been very similar to New Zealand. It's been a zero-tolerance approach. You see it, you try to stop it and stamp it out. Obviously, you've got quite significant hiccups at the moment, particularly with the New South Wales numbers, and I note the development of Victoria today. But looking at it from a New Zealand perspective, we're pleased that has been the Australian strategy. It means that at some point our bubble can reopen, and there's a lot of links both sides of the Tasman. I don't see the strategy changing here anytime soon. Kiwis rather like being able to go to their concerts and their football games and get out and about. And I think that they're prepared to put up with some isolation and keep those benefits.
Eric Feigl-Ding, can I just bring you in and thank you for joining us. I don't know what the time is there, but I think it's very, very early in the morning, so I appreciate you giving us your time. Can I wind the clock back here and go back to when we first heard of COVID? You've been called one of the prophets of COVID. You tweeted at the time. Give us those exact words of what you tweeted when you thought, oh, what are we dealing with here?
Well, thank you for having me. Well, Memory Road, if you rewind about 18 months to January 2020, I had once said, this is going to be a thermonuclear level bad pandemic.
I think you'd used the word Holy Mother of God, I think was the phrase you tweeted.
Yes, I also used Holy Mother of God. But I think in certain ways, you have to captivate people and make them listen, because it was during a time which people just were not paying attention anywhere in the world, unless they were China hawks and watched everything what was happening in China, which most of the world did not. And this was really, really scary. The data that was coming out of China, it was real. China had no strategy around the communications around it. It was as real as it can be. The signals were bad, but a lot of the Western scientists and leaders just did not have their ears to the ground. So in order to get the public attention, I had to go with Holy Mother of God. This is going to be a thermonuclear level bad pandemic that rivals what we've not seen since the pandemic of 1918.
You certainly got a lot of
millions of people have been affected.
You certainly got a lot of pushback and a lot of criticism for that. Some accused you of being alarmist. Yes, a lot of the things that you pointed out then have come to pass. The numbers of deaths in the United States, but you were accused of being alarmist and to generating this narrative of fear. Do you look at that then and say, well, I could have chosen different words, or I could have approached it differently?
Well, people cannot quite imagine what they've never seen before in their life. So yes, it was alarmism, but alarmism is clearly relative to what we've experienced in the last 18 months. A healthy bit of alarmism, and I'd rather say precautionary approach. There were people who said there was no evidence of human-to-human transmission. There's no evidence that asymptomatic transmission occurred, hence we don't need to mask if you don't have symptoms. There's people who said it's not airborne, and people said it's not airborne for over a year before finally the world recognized this is really airborne. And then people said there's no such thing as reinfection. Once you had immunity, you'll always have immunity. That's clearly not true. And right now, the Delta variant, we've been screaming about Delta variant since April and May, when India lost estimated at minimum 1 million to likely 3 million deaths in 2 months alone. And we've been saying it. WHO declared variant of concern first week of May. CDC didn't act until June 15th. UK acted mid-May, but people were still asleep at the wheel. And a lot of leadership, we want to hope. We really want to hope that COVID is over. I want to hope COVID is over. But if you watch what's happening, it is not. And if we saw the data from Singapore, it was clearly showing that there was vaccinated to unvaccinated transmission, asymptomatic transmission, and the vaccinated people could still transmit, which means high vaccination countries like Israel and the UK were not out of the woods. And lo and behold, we are seeing surges around the world, even in highly vaccinated Israel, and the vaccine efficacy has been dropping there ever since Delta has been invading. And US, with 55% fully vaccinated, is seeing surges in 48 out of 50 states. Yeah. And we're having a, sextupling of cases in the last month, and hospitals are at record highs in Florida. So you cannot argue about that. And we are way more vaccinated than even Australia.
Hi. Here in Indonesia, the pandemic doesn't seem to slow down. More often than not, I, like a lot other, live in fear and constant worry about our health and safety. Nonetheless, more and more has slowly embraced this new normal and accepting that maybe this is how the rest of our lives will be. However, I have underlying concerns as of when can we reach herd immunity here in Indonesia, where there's barely enough people getting vaccinated. So far, we have only reached around 6% of the total population. And when is it really safe to stop calling it a global pandemic? Thank you.
Yulia, Supadmo, so much concern there and worry about what it's going to mean for family. You're there as well. What are you experiencing right now? What is life like where you have been at some points registering up to 50,000 cases in a day?
Well, it's now a matter of managing your stress level, especially for us journalists here on the ground that are still required to cover this pandemic out on the field, especially our colleagues, the reporters and the camera persons who are out there on the field. Now, someone mentioned about a lot of leaders maybe took for granted this virus in the beginning, and critics of the Indonesian government have maybe said something in the line of maybe the Indonesian government was a bit relaxed at the wheel. I think that was the sense that we got after the Muslim holiday of Eid al-Fitr. So I think what took us by surprise was the entry of the Delta variant in Indonesia, which basically made the cases spike exponentially. Now, I know that Sydney has been in lockdown for 6 weeks and everybody seems to be in a panic after the number of deaths there, but you can imagine now the number of deaths in Indonesia have reached some 2,000 in a day. Now, the lady who posed the question said that this is the new normal that Indonesians have now tried to embrace. However, it was exactly this mindset that got us here in the first place. July was definitely one of the worst months for Indonesia because of the Delta, and the hospital facilities and infrastructure was just not ready for the number of cases that grew. You can imagine the government, I think, in the past 6 months have tried really hard to keep up with the pace and try to do better. However, because of Delta, the number of hospital beds, the medicines, the supplies, and even the vaccination rollout have not been able to keep up with how fast Delta is moving in the country. So if we're talking about when can Indonesia breathe a sigh of relief, I don't think it'll be a while, at least until the end of the year. Even the government has scrapped its idea of reaching herd immunity. As of today, the percentage of people vaccinated has reached about 10% of the target, and I think we'll still need a long time before we can basically breathe easy here.
And Damien Cave, you've reported a lot on what the responses have been throughout the region in Southeast Asia. What do you think is an indication of the way that it's been dealt with, and how countries are dealing with particularly these other strains, such as the Delta strain, obviously clearly having a devastating impact in Indonesia?
I mean, these variants are a game changer for the entire region. You know, Australia is far from the only country that did really well with the first phase of COVID and is now really struggling mightily in the second phase. Japan, South Korea, Taiwan,
story, yeah.
Singapore. Many of these places thought they had it licked, and it turns out that they don't. But part of the problem, I think, and part of the challenge is getting people to have a fair understanding of what the expectation should be. Perfection is impossible with COVID. We should get rid of this idea that we're all going to be able to go back to normal anytime in the near future. That's simply not the reality that we're seeing, especially with these variants. What we have to figure out a way to do is how to do as well as we can in the moment. And I think a lot of countries are trying to figure that out, and the range varies quite a bit. The thing that's really heartbreaking when you look around the world is that there's such inequality in terms of how vaccines are rolling out, excuse me, in terms of which countries are doing better than others. And unfortunately, a lot of it is tied to wealth and who has the power or distribution or ability to make vaccines. And so the world has an enormous challenge ahead. To some degree, you know, this isn't the beginning of the pandemic, but it's so far from the end. And there's a lot of work that needs to be done.
And Helen Clark, this is what you warned of, wasn't it, in your report, that there were things that could have been done and weren't done, and responses now that we have not learned from experience, particularly when it comes to providing vaccine for other countries. I mean, you listen to what Namira Jawas, our questioner, said there, 6% of vaccination and clearly dealing with this increase every day and tens of thousands of cases. This is precisely what you were talking about in your report.
Absolutely. The report that came out in May expressed great concern about the pandemic just rolling on, with the possibility of more and more challenging, maybe even more lethal, who knows, variants emerging. And vaccination is extremely urgent. The WHO has now articulated a goal, which would be to have 10% of the global population vaccinated, for example, by September. I understand it's about 1% now, so the chances of meeting that are pretty grim. We don't have enough vaccines in total being produced in the world. The high-income countries have ordered twice as much as what they need, and our panel said get them out there to low and low-middle income countries. But we also need radically scaled-up production. We're starting to see some more agreements, for example, to produce in Cape Town, produce in Senegal, whatever, but it is slow. Unless we can reach the WHO's target of 70% by mid-next year, and 70% really isn't high enough, this is going to roll on, and our lives will not return to anything like the normal that we knew. Well, maybe if ever. I'm on the pessimistic side of this.
Why is it now possible that in a Western democracy such as Australia, which supposedly values free speech, that it is now acceptable for a major media platform like Sky News to be banned because of what is deemed as misinformation? Some feel it is purely because they dare to go against the prescribed views that are status quo. Why is there suddenly only one acceptable viewpoint and no discussion is now permitted? Have we lost the ability to think critically and reason what is correct information versus fake news?
Damien Kay.
You know, I mean, I think that this act of killing a bunch of videos or removing them from YouTube is really a difficult thing. I think there are times when misinformation needs to be stamped out and where it's damaging and dangerous for society. But in this case, you have a private company that's removing videos, most of which were from a year ago, without a whole lot of transparency as to why they're doing it. And, you know, it's a slippery slope when you kind of allow this to remove. And I keep thinking of historians. When they want to recreate the conversation and the myths and the arguments and the disagreements that happened in that moment, because these are now videos that are pretty old, they're not going to have access to that. And are we better off because of that? I'm not sure we are.
Is there also a question here, Damien, of the media's right to voice opinions, to have dissenting views, for those dissenting views, even if they're unpopular, to be challenged with the facts, to be brought into, you know, the light of proper debate and argument, but not to be silenced?
Well, I do think that's important. I mean, the challenge with these tech companies, though, is it's not an even marketplace of ideas. You have algorithms that are going to be pumping out misinformation if that's what people want, that are going to be favoring outrage over context. And so I think the responsibility on these tech companies is different than it is just on a traditional media company, frankly. But I also think it's questionable to remove anything like that. And what I think the culture really needs is for these companies to be more transparent and for there to be an open process. And maybe we need to think of them as utilities as opposed to private companies.
So if they had a more open process, would you be happier? Because the way I look at it is this: there is no such thing as unfettered free speech. You know, if people say things that are truly harmful, either to individuals or to groups or to broader social outcomes, there's a question to be had. So for you, is it just about the process? You want a fairer process before material is removed?
I think it's important that the process is there, and I think you have the ability to then publicly debate whether or not it's correct or not, or why. I mean, my concern is how arbitrary is it? Why is this video being removed and not that video?
And what are the criteria? What are the benchmarks?
Exactly.
But also in this case, Kate, is, let's talk about Alan Jones, for example, as one of the videos here that have been removed. Entitled to a dissenting view, to say that there is alarmism, to challenge, to question some of the numbers. I mean, one of the things that we have seen throughout COVID is that often the dissenting view has been silenced or marginalised, and we don't have a much more open debate. Are they not entitled to have those views?
Look, I think, you know, I come back to what I say. In the end, I don't believe in unfettered free speech. You know, I think there's got to be, you've got to have some kind of system around it. I think the point that Damien makes is, well, what's the system and can we discuss that? I think what happens when you have the discussion is people start to say, well, people should be allowed to say that, rather than kind of say, well, what's the kind of framework? You know, coming out of this whole thing, for me, there's a few things you've got to think about. So one is our relationship with the state. You know, that's where I really think the issue is. You know, if we're going into, you know, volatile, uncertain, complex, ambiguous times, and what the pandemic has shown us is really the state is the only machine that can respond. I mean, private companies can't respond in the way that individual states have to this. So as we move into more volatile times, the state and the state machinery, to me, is going to become more and more important. So how do you build a relationship of trust between individuals and the state? So when you move into more complex areas, we can trust what they're saying. We believe what they're saying. You know, that there's people are taught around both sort of media literacy, health literacy, you know, all the things that underpin, you know, how you come out of these these kind of problems.
Julia, if I get a thought from you, when you look at something like this as a health professional, you listen to what's reported on Sky News, you listen to what's reported elsewhere. Are you in favour of removing different broadcasters from various platforms, removing people from YouTube?
No, my reasons are kind of strategic. So I look at this, you know, in the pointy end being with vaccination, where there's a lot of concern about negative media, social media, scaring people off vaccination. But the research that we do with people who don't vaccinate doesn't have in their stories an account of them seeing something on Facebook and it putting them off. It's much more complex than that. And I think when we think about the influence of misinformation in particular, we need to think about the environment in which that misinformation sets seed. And if there's mistrust, if there's a lack of justice in the way people are treated around in healthcare or around vaccination, for example, if there's an adverse event following immunisation, then people can be more attracted to those messages.
And that's what we've seen throughout COVID, questions about trust. Our final question comes from Paul Martin.
The SARS-CoV-2 virus is very sneaky, spreading between people before they have symptoms and when they have mild symptoms. Almost every country in the world has failed to contain this virus. It also seems likely it was spreading outside of China even before it was first identified by the Chinese scientists. Has it been indeed unfair and unreasonable for those who blame China for not containing the virus because they must think that China is so much better than all those other countries that didn't contain the virus either?
Helen Clark, your report said this was a preventable disaster. Part of being able to prevent that is transparency and honesty, and that's what was lacking, wasn't it, in the early days in China, where people who would blow the whistle were being targeted and silenced?
We saw that reported, of course. We also saw reported that when the doctors in Wuhan noticed the cluster of these cases of pneumonia of unknown origin, they did get testing done, and there was obviously information put into the public health arena about these cases. But there was a slowness to act in China. We looked at the whole month of January. We felt that the WHO didn't have the powers it needed to deal decisively with a situation like this. We felt that the public health emergency declaration of international concern could have been made earlier. But then we go on to say that February was a month of missed opportunity for most countries in the world when they should have been readying their defences and rather sat and watched. So there's so many lessons to come out of this pandemic. Be prepared, take WHO warnings extremely seriously. I hope every country now will review their experience with COVID, look at where they went wrong and resolve to do better next time a threat arises. Because we can't stop the threats arising. What we can stop is them developing into a catastrophic pandemic like this one has been.
And Eric, the fear is, of course, that there will be another potentially as well. We've already seen, I mean, you've spoken about, you know, a pandemic 2.0 with Delta. What lessons do we learn in our ability to be able to work together? And particularly, I think, given the alarms that you raised earlier about China and questions about where this emerged from. There is still debate about whether it emerged in a lab or whether it emerged in a wet market. Now we're 18 months or so into this. What have we learned and what do we need to build on for the future?
Yeah, I think the origin debate is beyond the scope of this discussion, and I think we won't be able to have the answer for a while. And it's true that they've detected SARS-CoV-2 in Italy around Milan
September,
back
I think
in
that was
October,
saying.
November. Yeah. Right, but I think the biggest failure is not what happened or how it started. We are going to get more pandemics of some sort of origin from animals at some degree. Many animals in the world already carry SARS-CoV-2. I think we can't avoid more pandemics in that sense. But what we can prevent is the catastrophic failure of our society to collectively come together. And this is not just criticism of people, but also of governments. Governments want to look at the other way. They don't want disruption of the stock market. They want for things to keep open. And I think, that's a good thing. But at the same time, they look they completely dismiss, just like we all have our biases, we want to dismiss the things that are not the inconvenient truths, to borrow a phrase, so to speak. And I think that happens, that's human psyche. And to prevent that, we really have to face things head on. That Dr. Mike Ryan, again, I cite him a lot because his philosophy that if you want to be right before you act, you will lose this pandemic. Perfection is the enemy of good. And I went to Geneva and spoke with WHO headquarters leaders just last month. And they are still very much in the precautionary principle. And they said that's what countries should really learn. The precautionary principle is the best way to defeat the pandemic. Not complacency, not basically hopes and dreams and prayers, because those are not strategies in a pandemic, especially something that has long COVID implications that will harm our economy and our costs of our healthcare system for decades to come. And I think our children are the future, and we should go send kids to school, but with masks and ventilation.
Okay, we've certainly made that point. Just on that point about children, you have children here, Damien, and your children have lost a couple of years of their lives, of not being able to be around family, not being able to visit the United States. What are these other things that we have lost and the impact it has particularly on children?
Well, I think it's important to think about costs that are not economic. Birthday parties that were never had, family gatherings that will never be replaced, that never happened. Funerals and weddings that were delayed and that were shrunk in size and where people never really got the closure that they wanted. And I think there are enormous costs that we don't often think about when we're thinking purely in terms of opening up as an economic thing. And for my family,
your
my
children
kids
have missed their grandparents.
Yeah, my kids haven't seen their grandparents in longer than they've ever not seen them. They haven't seen their cousins. My children are, growing from little children to teenagers at a time where they're not able to see their family at all. And I know that my family is heartbroken about that. I'm heartbroken about that. And I'm far from alone. There are so many people in much more difficult circumstances than me whose families are disconnected. And I'm not sure that Australia has ever really fully grappled with that. That what you're doing to a certain extent is keeping families apart. And yet the hope is, if we do this right, we can all come back together and do that. And that's perhaps what the message that also isn't being said, is this isn't just about protecting, your family from getting hurt and from getting sick. It's also about being able to bring our families back together. The more people get vaccinated, the more this country handles this well, the more unified families in Australia can be.
Stan, I think that as we look back on the lessons from the last year and a half, one of the things that we should be doing is looking at the strengths of where things have gone well, where communities have cooperated well. We've seen an amazing cooperation from Australians. And I love the example First Nations communities taking leadership right at the beginning, working with Aboriginal community-controlled health services, high-level cooperation between government and peak bodies that meant that Aboriginal communities were leading and are a global example of how to control COVID.
Yeah, it's a wonderful note to finish on and to remind us that the people who have been the foot soldiers in this, the people who have carried the load and the people who are going to get us to the other side are ordinary Australians, people who have made all of those sacrifices. Thank you all so much for being part of our conversation. That's all we have time for. Thanks again to our panel, Kate Mills, Helen Clark in New Zealand, Damien Cave, Eric Feigl-Ding in Washington and Julie Leask. And thank you all for all of your stories and your questions. Next week, David Spears joins you live from Melbourne. Until then, take care. Have a good night.